Hello and welcome to the Botanical Biohacking Podcast. Today we have a very luscious guest, Koji Otsuka.
Why am I luscious? Why do you keep saying
Because
luscious?
you have long, luxurious hair and I'm bald, okay?
That is true, actually.
I get to have a little bit of envy there.
Yeah.
So we're going to be talking about poison. Not the 80s hairband, again, with the hair. No, actual poison. Why? Because Koji has experience with it. So we're going to take you through a couple of folktales / historical incidents in ancient China, and then compare it with what Koji's actually seen in the field. So to start with, let's look at the famous story of Guan Yu in the Three Kingdoms era about 2,000 years ago.
All right, so Guan Yu was shot by a poison arrow in his upper left arm. It wasn't fatal, but it was really annoying for him. In order to remove the poison, they opened the wound up and they actually shaved the toxin from the bone surface and used herbs like sanchi to close the wound.
It sounds like it was pretty horrific.
Yeah, I think it was. I wasn't there, so I don't know, but I would imagine that, he wasn't happy about it.
Once upon a time, there was a snake. A snake's name was Roger, probably. And Roger bit Shen Jianshan. Shen Jianshan we're going to call Reggie because it's a more memorable name. Roger bit Reggie. Reggie passed out. Then 7 fairies came by. So what they do is they untie their scarves. I think of it like an ascot. And they wrap his wound. The Queen Mother came and took out a hairpin and laid it atop these 7 scarves or 7 ascots. And this magically removed the poison. So Reggie wakes up and sees that there are all of these ascots and hairpins on his leg, and they drop to the ground, and it magically turns into a plant with 7 leaves and 1 flower in the middle. So he thought it was a fever dream, but realized that this was the herb that saved his life. It was something magical. So after this, Reggie would talk about this constantly. Reggie would not shut up about the 七叶一枝花. So the 7 leaves, 1 flower in the middle is a way of identifying this herb which supposedly counters snake bite. I'm a little bit torn because the first story, the venom requires some pretty heavy-duty surgery. And the second story, it's just kind of one plant that magically saves the day. I can kind of see it more with the first case, but the second one seems suspicious to me. Sounds like a bit of a tall tale. I could be wrong. I wasn't there, as you said. So, Koji, you've actually had experience in the military treating vets who have gotten themselves into venomous situations.
I did have a couple of experiences in the military with active duty soldiers that would encounter different venoms. There are 2 cases that I think for me have been the most memorable. One was a young lady that was training in the National Training Center, I believe in California, and so while they're training, they're out sleeping in tents, and so during this time she had a scorpion crawl into her sleeve. So she went to sleep that night, and this kind of sounds like a fairy tale. She went to sleep that night, was sleeping on her arm, so her arm fell asleep. She wasn't aware that the scorpion was sort of crawling around in her sleeve. And I guess she must have rolled over on it a few times. It bit her or stung her several times during the night. And when she woke up in the morning, her arm was just completely swollen up. She went to the medic. The medic looked at it, wasn't really sure what to do with it. They did some training exercises. She didn't really get the treatment that she needed. Eventually they took her to, sort of a field hospital. They looked at it. They didn't do a whole lot. Eventually, even after the swelling went down, she had had problems with it. It had been months. I think it was probably about a half a year. She had a lot of numbness, tingling, range of motion issues in that arm. The stings were in the forearm area. She could feel the pain sort of creeping up her arm into her shoulder and getting up into the neck area. And then later, it was actually starting to cross over onto the other side and sort of come down the other arm. So how I dealt with it was mainly sort of orthopedically, just trying to get her range of motion back. Really, I mainly focused my attention on the opposite side limb. So you can use the leg as a proxy for the arm, and the way that the channels are balanced in the body, you actually will get physical effects in the arm by working on the leg. She immediately got pain relief. Her range of motion increased. I think, I must have treated her about 3 or 4 times over a period of about a month. The pain decreased quite a bit immediately. It started to creep back up again, but over time we got the pain to go away completely and the range of motion to come back.
Was the poison still there? Was it the way that the poison had affected the nerve? Were you waking the nerve back up? Is it kind of like, you've sat on your hand a little too long? Is it like The Stranger?
Yeah, I'm not really sure what the explanation of any of this would be. Yeah, essentially the way that I looked at it was that the venom in some shape or form, this is just how I conceptualize it. I don't know what the reality is physiologically, if all the venom had already been metabolized or not. I treated it as an obstruction in that channel and got that to move out through acupuncture by increasing the circulation in that area. I'm not sure. This is a good question. I have wondered also if it has more to do with the neurology, the neurological after effects of the area being traumatized by the venom.
So how do you know that she just didn't get better on her own, because it was, after so much time, it just sort of thawed out?
It was not getting any better. It was actually getting worse. It was progressing. It kept going up further towards the neck, and then it was actually crossing over the back of the neck and into the other arm. Over time it was just getting worse, and the other arm was actually being affected as well. So that actually, thinking about it now, that makes me think that there was some sort of neurological after effects of the venom.
Like a neurological inflammation cascade kind of thing? Yeah,
something like that. Whenever you're getting something bilateral, I think, there's often a suspicion that it's sort of your brain is involved in some way.
Was this the only case like this, or did you have any others?
Yeah, I had another similar case of a soldier who was he bent down to pick a flower for his young daughter, and a baby rattlesnake jumped up and bit him on the finger. Same kind of issue. With him, he went right away. Because he was not out in the field. He was in town, and so he got anti-venom right away. But there were issues with the muscles in his hand and his forearm spasming. I think he actually had some issues going on in his upper arm as well, and kind of similarly, there was lasting after effects of this where it was affecting his functioning and his sensation. Conventional treatment really didn't help him, and over time things were actually just kind of getting worse for him. So kind of treated it the same way basically, and that cleared up.
To get a deeper biomedical take on this, I've asked Xuelan, Ph.D., who has her doctorate in herb-to-drug interactions and the pharmacology of Chinese medicine, and Tom Whalen, M.D., who's an anesthesiologist, to give us their take on it.
We use poisons every day in the operating room. When people are under anesthesia, the surgeons want to have as much relaxation of the muscles to be able to see where they're going, open the wound efficiently. And so we give medications that block the actions of nerves. And at the end of the surgery, we give specific reversal agents to block the effects of these poisons. With some poisons, such as scorpion poisons, pufferfish poisons, psychedelic toad poisons. The poisons can have much longer effects and can be difficult to reverse. So those kinds of poisons aren't used in the operating room. One of the things that has been a concern for anesthesiologists for a long, long time, and has ongoing research about it, is are there other effects that are more subtle that we see with the operating room poisons? Because we know that from the more long-lasting poisons, there are long-term effects. So that, for instance, some of the scorpion poisons, Lan, and some of the pufferfish poisons are being used now to treat different forms of cancer, and are being used to treat rheumatoid arthritis. So that even after the paralysis effect wears off, there are effects inside the cells that last for days to weeks to months. How does that fit with your understanding of treatment from Chinese medicine?
It's actually very similar to one of the herbs that we used in rheumatoid arthritis even, called Lei Gong Teng. It's one of the herbs that's considered to be poisonous, but they've had the extract from it to actually treat it, to have the similar effects as you just mentioned.
That's fascinating. So using poison in a different dose or a slightly different form can counteract the prior poisonous effects.
Exactly. That's the old saying in Chinese, 以毒攻毒, use a poison to attack the poison. Yeah.
I like it.
Yeah, so for Chinese herbs, I was trying to look into the pharmacology mechanism behind the detoxifying effect. It seems like it's not a single point targeting effect there. It's always multiple targeting. Also, it works a lot on the symptom relief, such as to reduce the inflammation, to prevent the cell damage from the toxic, and to even interrupt some cells communication.
Yeah, that's really important. It's one thing to get someone to a place with anti-venom immediate reversal agents so that they can use their arm or breathe, but very little attention is paid to the inflammation that occurs long term.
Yeah.
It's really interesting about the inflammation. Koji, what did you notice in terms of the patients you had in the military?
Actually, a lot of them felt sort of coldness, and I would interpret that to be a lack of circulation in the area, maybe.
Mm-hmm. It's interesting. I've seen studies on acupuncture, both increasing angiogenesis, so blood vessel formation, and nerve formation when you get the inflammatory nitric oxide in that sweet spot. So I wonder, with the cases that you treated, if the inflammatory damage was kind of increasing and damaging the nerves, and that it sounds like you were able to get that under control and perhaps even stimulate some neurogenesis and angiogenesis to rebuild that tissue.
Yeah, could be.
Could be,
Could
right?
be.
Obviously, you have massive, clinical trials to check this out, but it sounds like a fairly reasonable mechanism. What do you think, Tom?
What I'm aware of with more and more neurological diseases is that there is inflammation either within the neural tissue or in the blood supply. And as the inflammation persists, the pressure in the lymph systems prevents removal of toxic wastes from the area. The accumulation of the toxic waste just creates a vicious cycle where the inflammation persists. So to find something that will break that cycle is not something that's a strong point in Western medicine. We typically rely upon things like ibuprofen and other non-steroidal medications that have some limited efficacy. Prednisone is also used, and that, if it doesn't work within a very short time, has long-term toxic effects itself. So finding a different method that can break this vicious cycle is really important.
Awesome. Thank you so much, everyone, for your perspectives. If you'd like to receive an email from us on show content, references, and additional information, such as contact for our guests, please go to botanicalbiohacking.com, scroll all the way to the bottom, and sign up. We have practitioner and general sign up. Also, please remember to rate us on Stitcher and iTunes.